Can lip filler trigger a cold sore? I don't think it's the filler itself. It's most likely the trauma caused by the needle. So the procedure itself can trigger a cold sore. And although this is a very hard thing to get hard data on, it does make sense that you may be able to limit the risk of this through causing less trauma while you inject. So it could be just as simple as doing fewer injections. I think you're much more likely to get cold sores if you've gone in and out of the lip, 50 times, like you might see with some techniques, than if you've gone in twice, like you've seen with other techniques. Similarly, you might experiment with the idea that you could use a cannula, not actually touch the lip at all. So you enter lateral to the oral commissure and treat the lip that way. That might reduce your chance of getting cold sores. And of course, you can use prophylaxis. So you can prescribe acyclovir before the procedure, usually 24 to 40 hours before you start the course of acyclovir. Then you do the treatment and continue it for 2 or 3 days afterwards. And that may prevent you getting a cold sore. So it depends on the patient, depends how frequently they do them, and it depends on your ability to prevent or use different techniques. These are just ideas that you can use based on the principle that it's the trauma to the vermilion border in particular that causes it, but very hard to be sure. I just don't think it makes any sense that the presence of filler itself causes the problem. It's the inflammation and the trauma. So reduce that, and you've got a chance of reducing the chance of cold sores, as well as the medical options that you've got. Hope that helps.